that a small human being.
Yeah.
Whoa.
Did you just cough?
Yes.
Hello and welcome to this slightly special edition of Curious Celebs Between Two Nerds, where we have invited a small human being in to have a chat with us, but this time we have told that human being what they're going to be talking about, and we've gone a little bit current affairs. So let's get straight on, introducing our small human being, who our subscribers may recognise.
Hussein.
And how old are you, Hussein?
9, nearly 10.
Oh,
9, nearly 10.
Hesitation there, are you sure?
And you've been on before, right?
Yeah.
On, I think, episode 9. And what did you ask about then?
I actually...
You forgot?
It was a long time ago,
Yeah.
to be fair.
I asked about Jenny.
And you know the nerds. I'm Mo.
And I'm Eugene.
Right, Hussein. We've given you the topic
Of
discuss of
Coronavirus.
the coronavirus. And do you have a question to ask about the coronavirus?
Why is everyone so scared of it? It's just a more dangerous cold.
Okay.
Solid.
Right, fair enough.
I hope you enjoyed this episode.
So, why is everyone so afraid of the coronavirus? First thing, actually, the second part of your question, where you said it's just like another cold, it's not. So.
Well, a good place to start there is, see, the coronavirus on language. The coronavirus or a coronavirus could well be the common cold.
Yeah.
So it's not that we're scared of, and it's important that people distinguish. So you've had coronavirus. I've had coronaviruses. Mo's definitely had coronaviruses.
You're trying to say?
And you've had a lot of them. So coronavirus is a type of virus.
Yeah, like a family of viruses.
So, which may well be the common cold. So it's not definitely has to be the common cold, but if you have a common cold, there's a good chance that that is a coronavirus. Yeah. The one that everyone's scared of and that's in the news and the reason that lots of people aren't at school.
That came from bats?
We don't really know yet where it came from. There's lots of stuff out there.
Most likely, yeah, because there have been previous ones that have come from bats, but they don't get to us directly from a bat, because they could go to another animal and then a bat. But like Eugene was saying, so coronavirus is a family of viruses. Some of them, there's about, I think, 4 or something, that if you get infected with that particular coronavirus, it will give you symptoms. Right, just like the common cold. Do you know what a symptom is?
Either side effects or things it can do.
Great answer.
Yeah.
I asked Eugene where he thinks where he thunk the coronavirus
No, I like funk.
thinks the coronavirus came from. He said from possibly a previous wildlife. Where do you think it came from?
Well, scientists aren't... Okay, we know geographically where it came from. So it started in China, in the Wuhan province, right? Do you mean like how did the virus suddenly appear? Scientists think that it started in a bat first, in bats, because bats do have... Yeah. So bats do have coronavirus, different types. But, so there have been previous coronavirus outbreaks of different ones, like called SARS and MERS, and those also had started in bats, but they went from bats to another animal, and then transmitted to a human. Okay, so... Huh?
Why is it called coronaviruses, and what does corona mean?
Okay, very good.
That is a good question.
So it's called a coronavirus because if you look at the virus underneath the microscope, it has these little things sticking out of it, little projections, kind of like a crown all around though. So that's what corona is. Crown in Spanish or something? Or Latin?
Yeah, in a language.
Yeah. Yeah, so it has this thing surrounding it. And that's actually very important for how it infects us. But speaking of it, so you asked first, where did it come from? So from bats, it would have gone to possibly another mammal, because coronaviruses do infect mammals and birds. And they think that mammal possibly is a pangolin. Possibly.
What's a pangolin?
It's like a tiny armadillo thing.
Quite cute.
Yeah.
Baby ones are.
So far,
Very good.
good. So far, they think it started from this one market in China, in Wuhan, right? Where possibly they had like caged bats maybe on top of this other animal, which could be a pangolin. No one's sure about that bit yet. Okay, there's still tests that need to be done. But there's some evidence for it to have transferred to. Are you raising your hand to ask a question?
Yes.
It's just let me finish this point and then you can. Right, so you never raise your hand, ever. I've never seen you do this. Right, so from these two animals would have been kept in close proximity to one another, giving this virus a chance to go first from the bat to the pangolin, possibly pangolin, and then to humans, because humans are around that market. Okay.
We should probably say at this stage, we've talked about why is coronavirus called coronavirus. We've talked about...
I've got one.
Well, I've got one. So what is it called? So we had to name this particular virus.
Yeah.
So scientists gave it a name, which I'm saying COVID. I've heard some people say COVID, but COVID-19. So this particular coronavirus, very good, is called COVID-19. So we should be referring to it as that.
Yeah. By the way, for those listening, every time Hussein coughs and Eugene says very good, it's because he's using his elbow. He's coughing into his elbow,
Into
which
his
is
flexed elbow.
Yeah, which is the right thing to do.
Do you know why that's the right thing to do?
So your germs don't spread?
Yeah.
Yeah, but why is it better than that? Because when I was growing up,
Because
it's like coughing to
the
your
germs
hand.
go into your hand and then you touch everything.
Very, very good.
good.
Absolutely. You don't touch many things with your inner elbow.
There you go. So COVID-19. So that's where it started. Okay. So we should talk about the symptoms of this, right? So when you get it,
Oh, question.
yeah, sure.
Are there any bat dishes? Because there's a possibility for this particular coronavirus that it might have gone straight from bat to humans.
I don't know if they're
maybe
bat.
if there are bat dishes,
Maybe.
human eating bat.
I would say on that because you're the fourth or fifth kid that I've spoken to that's brought that up, because that means that rumor has spread like wildfire through the internet.
But are you
virus.
serious? I just thought it out.
You just thought it up.
Really?
Yeah, but lots of people.
Oh, well, it's a logical thing to think.
Yeah.
Is there a bat dish? Do people eat bats? And yet, around the world, there are people that eat bats. But there's lots of stuff on the internet which isn't by definition true, or we don't know. So I've had kids asking me about...
People are allowed to post websites.
Yeah, you can post whatever you like. We're posting whatever we like. But there's stuff like bat soups and things like that, and that's where it all started. We don't know where it all started. So I think as a populace, we should be careful of just spreading news.
Yeah, but it doesn't have to be because someone ate a bat. It can just be from being around bats or being in places where bats live.
The bat sneezed.
Maybe a zoo.
Zoo, yeah, but even if you were in a jungle, I mean, we get bats here as well. And then there's bat droppings, and then you're around it. You don't know what it is. You might touch something that had a bit of bat poo on it, and then touch your face. Okay.
Only from touching it.
Yeah. So, but they think because of the DNA, we talked about DNA, because of the RNA actually in this virus, that there are some similarities. There's some evidence to suggest that there was another animal it got transmitted to, and then to us humans. But if you did get it, first thing you'd get is a fever. Then you might have difficulty breathing. You'd cough, right? And what else? You might get some muscular pain.
Yeah. So it's like, so what it isn't is the common cold.
Yeah.
So runny nose is the classic that is not a symptom of this, because this virus goes much deeper into your lungs.
Yeah.
So you're first and foremost, and the main one that's being checked at airports, and the easiest symptom to track is a fever.
Yeah.
And a fever is when your temperature goes higher than it normally would do. Then it can go to coughing and sneezing, to a cough that almost definitely is a symptom, and trouble breathing or shallow breathing.
Yeah.
And depending on who you are and how healthy you are and lots of other factors, those symptoms may be strong, may be weak. So there will be people that have had this virus that don't even know that they had it, which sounds fabulous. So that gives people, so when you hear that news, it's like, well, that's amazing. It's nothing to worry about. If people are getting this virus and not even noticing. But there's a big problem with people getting the virus and not knowing they've got the virus. And that's, so let's say I've got the virus. I haven't. But let's say I have. And I don't know I've got the virus.
It could spread from
Very good.
Absolutely. So I'm not locked, self-quarantining in my house. I'm not in a hospital. I'm not in
isolation.
I'm not in an isolation room.
You should be.
Because I don't even know.
Rule.
Yeah. So I don't even know that I've got it. So if I don't know that I've got it, then you may get it. You may get it. Everyone that I meet may get it. I may not be as hygienic as I should be.
Yeah.
So I'm spreading the virus to others, and the more this spreads, the more damage it does, because there are a percentage of people who it's going to affect more fatally.
Yeah. So there have been coronaviruses just in the last 15, 20 years. The big ones that also made the news. One was SARS, which started again in South Asia, right? And one called MERS, which started here in the Middle East. But those ones were a lot more severe, which actually helped not spread it as wide because it was so bad, people took precautions, right? And, tried to make sure they didn't spread it to other people. And another problem with this one is that it has like a 2-week incubation period. So if you do get it, you may not have any symptoms for about 2 weeks. So for 2 weeks...
So you need to stay in your house for 2 weeks.
Not just that,
or stay in an isolation.
Well done.
Thank you.
Eugene coughed into his elbow as well. Good job.
We're all coughing there. If you cough,
I'm not.
We'll cancel the episode. Run home.
Yeah, so people for 14 days don't even know that they have it. And they're going around and spreading this virus even more, which is bad. So giving it more chances. So that, coupled with the fact that the symptoms aren't that severe, means that people are more likely to spread it to a lot more people. Now, whenever we're saying how quickly a virus can spread, epidemiologists and people who study this, people who study like how diseases spread, look for each virus, each disease will have a number called an R naught.
Is that something to do with RNA?
No, it doesn't.
It does have the same letter though. So
yeah.
Fair
So
question.
it says, if someone does get the virus, how many people will they spread that virus to?
As much as...
Yeah. So that's what this number says. So for this particular coronavirus, COVID-19, it's about 2. A little bit, yeah. So 2. So each person that gets it will possibly... Now, again, this number, they're still learning. Scientists are still learning more and more about this. It's still very, very new. It's only been, 2 months, right? And a lot of the data from before, we don't know how accurate it is. Okay, so let's say in a week, if I got the coronavirus, COVID-19, and in 1 week, I would spread it to 2 other people. In the next week, those 2 would spread it to 2 other people.
So
now we have 4 people. Well, plus me.
Then it goes 8.
Then
okay.
it goes 16.
8,
So
16,
now this is called
32,
a geometric progression.
64.
So just in 10 weeks, we'd reach 1,000. In 20 weeks, we'd reach 1 million. Right, 1,000,000. And in 30 weeks, you'd reach 1 billion. That's 1,000,000.
I know what the billion
Yeah, no, but I'm just saying, so every 10 weeks, it just goes up and really spreads really quickly, right? So the R naught of 2 is
So it's kind of like... So it's
great.
kind of like going to the power of 10, then to the power of 20.
Yeah. Well, raised to 2, powers of 2, yeah.
But that's why. So there's a lot. There's a lot. You're going to get every opinion out there. But there's certainly people with the opinion that there's an overreaction because you take this. Well, if I'm being blunt, it's only killing 2% of people. 3.4 is the latest figure.
It kind of is an overreaction because not that many people are getting it.
So you're absolutely right. There's people that say there's not that many people because 80,000. I haven't checked what the number is today, but it's 90,000. So that's a lot of people, but relative to, I mean, it's a football stadium. That's not a global fear. But that's putting all these precautions in place. So the reason that all the schools and nurseries are closed in the UAE, certainly, and in other countries,
is because usually the people who are young haven't really grown their, what's it called?
Immune system.
Actually, on this, we think it might be the flip. So while you haven't grown your immune system, what you have got is loads of coronaviruses.
Oh, you've recently been infected by a coronavirus.
Had.
Yeah.
Which gives you we're not sure why, but may give you kids a stronger immunity.
Yeah. Raising your hand, yes, you had another point.
If you're scared of the coronavirus, but you still want to travel, why don't you just travel somewhere which hasn't had any cases of coronavirus?
Well, that goes to what I was saying. So the reason that we're shutting the schools, the reason that we're worried about travel is because, as Mo was describing that, the spread and how aggressive that spread can be and how quick those numbers can go up, the things that are being put in place that some people are claiming as an overreaction or the world going mad is to stop that spread. Now, if you want to travel, you can travel. Oh, there's places I certainly wouldn't recommend you travel if you're trying to avoid it. But it's not.
Eugene?
Yeah,
Come on, you're going to throw a few countries under the bus?
Well, no. We'll only give official advice. But there's certainly places I wouldn't want to travel from a selfish perspective because I don't particularly want to get this virus. And there's places where I am currently more likely to get this virus than others.
Such as?
So you take Wuhan. So Wuhan was on lockdown. So you've got 50 million people in Wuhan where this was most prevalent and where this virus started. 50 million people on
Lots
lockdown.
of people in China.
And that got locked down to the point where they weren't allowed, all of them, all 50 million. For a while, they were allowed 1 day a week where they were allowed to go out. And then that was cancelled.
It's like they're grounded.
You're not allowed to go out. So there's two reasons I wouldn't want to go to Wuhan. One is you're not allowed to go out. So what's the point?
You're not even allowed in.
And two, it has you're not allowed in. That's very true. I've got a much higher chance of getting the virus if I go to where the virus is most prevalent. So I would avoid that.
Yeah. So right now, okay, so should we be, you asked at the start, should we be scared, right? Why is everyone so scared? It's just like the common cold. First of all, it's not just like the common cold, right? And should we be scared? Now, I wouldn't say, okay, there's no need to panic. Okay, so right now people are anywhere between two extremes. There's some people that are starting to really panic, right? And there's some people that are kind of annoyed at all of this panic, let's say, right? And it'd be good to, don't panic, but don't ignore it. I mean, the steps that are being taken are being taken for good reason. And in fact, you would rather overreact than underreact. Right?
Sure.
You'd rather be safe than sorry.
Or you could react the
right amount.
Amount.
Yeah.
Perfect.
Always a right amount.
But
yes. It's hard to know what the right amount is.
And it depends on your perspective. So if you're going, people are scared of this for personal reasons, like I don't want to get that virus, I don't want to be ill, that's one thing. And you can actually, there is enough data there.
That's not selfish.
But we're naturally selfish people.
Yeah.
But there's enough data there at the moment for you to start giving your own risk assessment. So we already know you are at less risk than me because you're much younger. And for reasons we've only got theories on at the moment, children generally don't get this virus, this COVID-19.
But you've fully grown your immune system and I think you've got better lungs. So maybe the chances of me getting it are lower than yours.
Yep.
But the chances of me getting more affected by it are higher than yours.
Actually, no. So the data that we've got so far, you're in the pretty safe zone. So not many kids get it. Very, very few kids get it. And those that do have very, very mild symptoms. Generally speaking, as a rule, the older you are, so if you're going to take the selfish view, which we all do, the older you are, the more worrying it is. So the person sat here that should be most worried is me. Yeah. But then you've got to take another view, or the world or governments certainly have to take another view, because economics has a massive impact. So even if everyone's ill and no one dies, it's still an illness, and it's still an illness that lasts. So it lasts a couple of weeks. It's not like, felt a bit rough for 2 days and then I was back to work. This generally lasts for about 2 weeks. So the UK came out with their plans, and they're planning for 1/5, 20% of the workforce, everyone going to work, not being at work. And actually, I think that's potentially underplaying it.
Yeah.
And that has a massive impact on the economy, on schooling, on business. So it's not just about, am I all right? And if you look at, if you sort of play back and take COVID-19, and this is theoretical, but you compare it to previous epidemics or pandemics. So there's been, do you know the difference between an epidemic and a pandemic?
Have you heard those words?
Have you heard
before?
either of those words?
Yeah.
So we are teetering our way towards a pandemic, which is where this virus is spreading globally. So it's pretty much all over the planet, this virus is spreading. That's a pandemic. Now, there's been previous pandemics that we do know what happened, and we can look at the data there and how many people died.
But this one's too recent, so we can't look at it.
No, but we can predict.
So about 100 years ago, there was a really bad one, right? It was called the Spanish flu. And it was caused by an influenza virus, the same one that gives us the flu now, but a particular strain that came out of nowhere as well. So it wasn't there previously, and it was just a particularly bad outbreak of it. It was a completely new strain of that virus, and it had a mortality rate, which means how many people die from it. That's similar to what they think COVID-19 is right now, although that number is still not accurate. But the Spanish flu had about between 2 to 3%. Now, 2 to 3% of the population would die from it. Okay, trying not to make it grim, but 2 to 3% of the population dying. That's a huge amount. At the time, the world's population was 2 billion, and the lower estimates of how many people died from from the Spanish flu, the lower estimate is about 17 million, and the highest is about 100 million.
It's a lot of people.
That's a lot. So that number, what that means is, so it's not so bad that number means that you personally, right, or all of us would know someone who's died from that virus. That's that number. So 2% is a big deal. That's a lot.
But even if you take out the stats and mortality and just think about the spread of a virus, there's a very sensible reason to try and stop it spreading, and that's because that virus can change. So the more that virus is out there, the more likely it is to change. What were you looking at? You were gone there for a minute, weren't you?
Yeah. What were you thinking about?
I don't know. I don't know. I think it was from a World's Worst Children book. I don't know if it's a real sickness. But I think I heard of something called
Black Death.
Black Death. Yeah, that
Black
was
Death, where it came from mice on.
This isn't that.
Now again, that one.
It might have come from
rats.
Rats or different animals.
Yeah, but that one. So the particular Black Death, they actually think it started in Central Asia, like Mongolia region, from a marmot, which is kind of like a beaver sort of thing, right? But obviously not a beaver, a wrong continent. But then it got carried by fleas to rats, okay?
I think the rats came on a ship.
to Europe. And that was a terrible one. That wiped out about 1/3 of the population at the time.
Is that worse than coronavirus?
Yeah. That was really bad. Yeah. But then this was a long time ago, so they didn't even know about germs to begin with, even with Spanish flu. So if, heaven forbid, we got Spanish flu now, it wouldn't be as bad as it was then. Right? Because we have antibiotics, we have things to fight off. So one of the things when you get this virus, right, or when you get any virus, it might not be that the virus is what kills you. It might be like a secondary infection. So while you're sick, you might get something else, another infection that actually kills you, right? So we have ways of we have ways of fighting off with antibiotics and respirators and all of these things to help people survive this virus, at least. But so far, the troubling thing about this one is that so far, there's nothing that's really helped the people that get really sick. There's not a lot doctors can do. It's not responding to those treatments. But anyway, it's a bit grim. But yeah, so now, at least now, like it wouldn't be something that high because we can fight it, and scientists are working really, really hard all around the world trying to find a cure for it.
A vaccine in a year would be amazing.
Or a vaccine.
What's a vaccine?
Okay, good question. So vaccine, you've probably had your like vaccination. So it's when they give you...
They give you the injection with things to help you fight off.
Yeah, so it boosts your immune system so that... Okay, let's say for chicken pox.
Sometimes they give it to animals or
yeah, they can do, I guess. I'm sure, yeah.
No, because I think I heard something.
I'm sure in agriculture they do.
Vaccination.
So vaccination. So that's where they might give you like a dead form of the particular disease or a form of it, and they inject that into you. It helps your immune system be able to fight that off in the future, like for chicken pox or something.
Is chicken pox that bad? Is it bad?
It used to be.
It certainly was last Christmas.
Yeah.
It's not great as a grown-up.
All I think it is dots on your face.
See that? Can you see that there? See, there's a little indent there.
No, not really.
Good. Because I amazingly, I kind of blame my mum for telling me that I'd already had it. Yeah. 41 years old, Christmas, chicken pox.
Yeah.
Absolute rubbish.
Is it bad?
Yeah.
How bad?
Especially if you're older.
What does it
Deeply
do?
uncomfortable.
What
Get
does it
fever.
You get these spots, but they're itchy. But you get massive feet. It's like being really ill.
Yeah.
You actually have to stay in bed.
Yeah.
Which I always see people staying in bed. I'm like, oh, come on, you can get up.
Yeah.
No, turns out you can't. No, you really need to stay in bed.
But anyway, back to this COVID-19. Yeah, so we should be... I think the right way to put it is we shouldn't ignore it. Should be very careful.
Yeah, you absolutely.
Right.
That's washing your
Not
hands.
too careful.
No.
Not too careful.
You want to be...
Too careful is like overreacting, traveling at all, any place. You'll be like, no.
Yeah, that might be. But at some point...
I would generally, I think, the best people to follow is your local government's health website.
Department?
Yeah, health department, or the WHO, which is the World Health Organization. And in America, there's the CDC. Here we have the Dubai Health Authority, right? Follow what they're saying because they listen to them. It's not, they're not trying to overact because trust me, they're trying to balance everything from the economics of it to the actual public health aspect of it. I know it might seem like right now we got this early spring break and there'd be few people who had holidays planned in, let's say, April.
Yeah,
right?
Disaster.
And they're annoyed about it. But no, there's a good reason.
Yeah.
Trust me, this is better than something worse happening.
But the more it spreads, so that virus changes, which makes it harder to deal with potentially. Because for a virus wants to survive. So it's kind of like evolution. It's natural selection. So if a virus, so let's say the worst virus we can imagine, not COVID-19, but I've made up a virus, everyone that gets it dies in an hour. So that's bad news. But actually, that's terrible news for the virus because if you're dead in an hour, it's very hard for that virus to spread.
Yeah.
So it could mutate to become potentially even less damaging in terms of its symptoms, which makes it more likely to spread even faster, which is success for the virus. Yeah,
so we should be worried. There's a chance that what's going to happen now, because we don't have a cure yet, we don't have a vaccine yet, these things will take time. Even once they discover one, they have to test it out. They can't just start giving it to people, right? They have to test it out on animals and humans and then make sure it's safe for people to take. And that's once they find one. There's a chance like most viruses don't like hot weather, so there is a chance that maybe come April, May, that we'll start to hear less about it. But that doesn't mean it's gone away because the same thing happened with the Spanish flu. Right, there was in the springtime, there was like this whole...
Is the Spanish flu worse than this?
At the time, it was really bad.
It was bad.
Would it be bad this?
No, it wouldn't be as bad now.
Well, so we know of the Spanish flu because it happened. We're looking back and it's all done and dusted. We've got all the data. We know exactly what happened. This is happening.
Yeah.
And hopefully, if we do follow that advice and we don't get complacent, you keep washing your hands and you cough into your flexed elbow beautifully like you have done, then we can limit the spread of this, and in 100 years' time, people won't remember COVID-19.
But like with that, it might go back, it might go away, but then it might come back even worse, like in autumn.
Yeah.
Because that's what happens with
Spanish flu.
viruses, and that's what happened with Spanish flu. Maybe, so we're not sure. Also, we always think that because in the past there have been previous outbreaks of certain viruses, and everyone thinks that in the news, it was all in the news, there was a bit of a panic, and then nothing really happened. Well, that's a good thing, right?
It's the boy that cried wolf.
Maybe it was because of the panic and people started to take it seriously that nothing happened. So don't get annoyed.
Don't get complacent because, well, no one died last time.
Yeah. And don't say, oh, yeah, but it's only bad for old people. That's bad. I thought we like old people, right? that
wasn't so good.
Like, we like old people, right? Because with old people, it's killing about, 15%? That's not great. Like,
a lot of old people.
That is I think it's a very insensitive thing to say. So, yes, there's that. And what can we do now, right?
We could try and find cure.
No. There's not much luck of us finding a cure. But
I had to look under the table.
What we can do is to make sure to try to make sure that we don't spread it. So first thing, wash your hands
a lot,
properly and regularly.
Would it be better to wash your hands or shower? You should wash your hands anyway, but...
No, you should, not just every day.
Anyway.
Sorry, it's not a once a day thing. Okay, first thing.
It's good to wash your hands, but would it be better and more healthy to wash your hands or shower?
Possibly a shower, but...
The sort of thing my kids will say now is, I've washed my hands 8 times today, so I'm not having a shower.
Yeah.
I'm not having a bath. Washed my hands yesterday.
No, wash your hands. Okay. Regular, and not just a little wash of, like, cursory wash of the hands, or just wet your hands. Get some antibacterial soap, scrub for at least 30 seconds. And here's the important bits, because even when you wash our hands, we forget parts to wash. So, okay, we always do that, right? That's not enough. So we have to wash your wrists, like scrub your wrists, do the in between the fingers, those bits there. And even, this is really important, the nail beds. So scrub your nail beds, because you see all those little grooves there? Like, these are great places for germs to hide. So scrub that. They're saying at least 20 seconds, but there's no reason it has to be that low, right? Like 30, 40 seconds.
Hand washing party.
Okay. And also, stop touching your face.
Yeah.
Humans touch their face from anywhere from about 3 to 20 times an hour.
There was a video I saw yesterday, and I think it was a US health official, and they were at the stand on TV giving advice to the general public. So you don't wash your hands. Wash your hands. Never touch your face. Avoid touching your face. And she has to touch. She's got notes, so she's licking her finger and turning the page. It's amazing. What a perfect example.
So stop touching your face, because this is how the virus can get in. Because you pick your nose, or you put your finger in your mouth for some reason, like licking your finger to turn the page, or you touch your eye. These are the ways the virus gets in. So wash your hands, stop touching your face. And especially wash your hands regularly.
Or can you at least wear gloves while touching your face?
Yeah, but if you've taken that... Now, another thing is, okay, so the way this is spreading is by people coughing, and these little drops of mucus and saliva in the air, and someone breathes it in, right? Or also those land on a surface. Now you've touched that surface, and then you've touched your face. So I mean, you can't stop touching surfaces, but try, like, you wouldn't do this, but try to disinfect surfaces regularly. But the most important thing, so now if you're wearing gloves as well and you touch that table, let's say the COVID-19's on there, and then you touch your face, there's no point of gloves. Gloves aren't magic. They're not going to stop the virus from spreading. So don't touch your face, and wash your hands regularly and properly. And face masks.
Like that special face mask.
Yeah, the special face mask. That would be a very good face mask for it. But that might cause a little bit of a panic. But not all face masks are the same. And anyway, what the WHO and all these people are saying, don't wear a face mask unless you are sick.
Yeah.
Because then you can then at least you don't have to keep covering your mouth with your hand, which you shouldn't be doing. But then you have the face mask to stop the spread of your disease, right? But there's a shortage of face masks around the world, right? And the people who really need it are the the doctors and the nurses. So most face masks are not going to give you enough protection anyway. There's a special one that doctors wear. And even that, you have to put it on properly with a proper seal around your mouth. Even me and Eugene couldn't wear that because we wouldn't get a proper seal because of our beards. So face masks, unless you're sick, don't wear one. And don't hoard them. Don't stockpile hand sanitizer as well. Don't panic. Okay? And
don't touch your face.
Don't touch your face. You got them all?
I think that pretty much covers it. Do that, you'll be all right. If everyone does that, we'll all be all right.
Don't cough on your hands and touch.
Very much don't cough on your hands.
Shaking hands as well, things like that.
Air high fives.
Sneezing on your hands.
Yeah, and when you sneeze or cough, but this is general rule, not a COVID-19 rule. Don't just cough into the air.
Don't spit.
Don't get me started spitting. Okay. Yeah, don't cover your mouth with your hand. Get the crook of your elbow, cover your face, and cough like that. That's if you don't have a tissue.
That'll sound great on the podcast.
Yeah, that's if you don't have a tissue. Right?
Hygiene on the podcast.
And don't reuse that tissue as well, please. Yeah. And put it straight in the bin.
Yeah. Hygiene on the podcast.
No, but like that. Cover your mouth. Right now, guys, I am covering my mouth with my crook of my elbow.
I've never agreed with the handkerchief.
Oh, that's horrible. You just put it back in your pocket. That's vile.
I think in a book, some people get wet handkerchiefs and put it down their sleeve or something, then take it out and use it and put it down.
Is that right?
Don't recommend it.
It's like a Dickensian novel. Any last questions? COVID-19. So are you afraid about it now?
Not really.
Good.
No? But are you going to ignore it?
No.
No.
Perfect.
Are you?
I'm going to react, but not underreact or overreact.
Yeah.
Excellent
Find
reaction.
that balance.
That perfect reaction. That's what we're after.
Yeah.
Very good. And listen,
by the way, if you think you have it, right, and you've come into contact, call your local health authority first. Yeah. Do not just go straight to a hospital.
In an Uber.
Try to avoid hospitals. Unless the health authority said, okay, go down to the hospital and get yourself checked in. Because hospitals aren't great places for not catching viruses.
No. It's the last place I'd want to be.
Yeah. Avoid crowded places.
Yeah. Okay, got it?
Yeah.
Yeah?
Good.
Thank you, Hussein.
You're welcome.
So hopefully you enjoyed that episode and we have either raised your fears or relieved your fears to the right level.
Yeah.
We've got your fears at the right level. If you have stumbled upon this content and would like to see us talk about some of the other stuff that we talk about, which is unscripted science, please do hit that subscribe button and the little bell.
That was new. That was new?
Yeah, no, I'm winging it. Winging this
We're always
exit.
winging it.
Please hit the like button. We love that. We've hit 3,000 subscribers, which is, show me the 3,000 subscriber celebration. I'm going to take whatever you just did.
Hit the like button.
Oh, is that what you're doing? Yeah, hit the like button.
Is that what people do?
Is that what people do?
I don't think
do whatever you just did. Yeah.
So why'd you make us do it? Why'd you make you
I
didn't do
just
it?
made it
You
up.
made him look more of a fool.
It could go viral. Anyway, thank you for watching. Do check out some of our other episodes. We load content every week. Right, now we need to wave with a smile to the camera in this camera here.
Bye, guys.
Thank you.
Don't get sick.